Hello people, we are here looking at another emergency case discussion. So the person has come in with something like this. What is this? Frostbite, freezing cold injury. So you have to tell the correct statement about the management of frostbite, freezing cold injury. So your options are, let me read. The affected area should be rewarmed immediately. Do you rewarm? I think giving them warm liquids to drink and putting them, removing all those cold things and giving some warm dry clothes will be good only. The affected area should always be rewarmed immediately in pre-hospital environment. What is that? Early amputation is gold standard therapy, not at all. You don't amputate something without trying to treat it, right? Rubbing of the area and application of heat pads. They are saying don't rub and don't apply direct heat. That's what they are saying in the treatment. So don't do this. Analgesia is not required, not at all. They need analgesia. Aspirin and ibuprofen are recommended. What do you think the answer is, people? Yes, the answer here is aspirin and ibuprofen. Okay. So aspirin is going to be a blood thinner type, right? So it is going to allow more blood circulation, and ibuprofen sounds like an analgesic here. So frostbite, right? They are telling that what you should do, you should give them warm drinks, you should give them warm IV fluids, right? Don't give them cold IV fluids again. Then you should give them, you should remove all the wet clothing, wet jewelry, etc., shoes, etc. And then you have to redress them in warm and dry clothing. Okay. Then what else you can do? You should not rub the area like we told you. You should not place it directly under heat sources. Aloe vera gel, they are saying, can help in anti-prostaglandin effect. So you can apply before dressing, they are saying. Then you can also keep them in warm water, flowing water, they are saying, so that it doesn't touch the container edges. In this warm water which is flowing, you can also add some antiseptic, they are saying. Okay, and then you can give strong analgesia like we told you, ibuprofen they are talking about. And then blister care, etc. So basically here, why is this not the answer? The affected area should always be rewarmed immediately. I'm not sure of that, but the answer here is aspirin and ibuprofen are recommended. They are saying that prophylactic antibiotics and all this tetanus and all is not required. They are saying there is no evidence for all this antibiotics and all. Okay. Frostbite wounds are not considered tetanus prone, so no need to give tetanus also. So mainly you have to rewarm and you have to give this aspirin, ibuprofen. I have a feeling you should also make sure that you have not elevated this part of the body, because then the blood supply will reduce more, right? Some things they're telling, if the groin is hot or if the underarms are hot, you can keep this toes in the underarm. If the underarm is warm, that's what they're trying to say. So rewarming is an option only. Okay.